Hello, I'm John Vecchio, Campus Director and CEO here at Arlington Career Institute. Thank you for agreeing to be a PAC member. Our accreditor has amended the PAC process, and we need meaningful dialogue and input from all PAC members. So please, tell us what we're doing right and tell us what we can do to improve. Thank you again for agreeing to be a PAC member, and enjoy the tour video.
Good morning and welcome to ACI. My name is Alana and what a pleasure for you to be here. We are in the Sims Lab and today I'm going to show you many things that we use to simulate what we do in the real world on real patients. But unfortunately, we have Jane and Jamie. You ready? Okay. So for us, personal PPE is important. Why? Because it stops the spread of infection. So what we do, we use Sani-Cloths. Sani-Cloths are hospital-grade sanitary napkins so that we can properly clean our mannequins and make sure we are not spreading infection because, as we know, infection causes death. Yes. We don our gloves, universal precaution. We don our face masks to stop the spread of droplet precautions. We do have our PPE. This may look very familiar as we dealt with the COVID pandemic over the years. Now, I want to kind of gear towards some other things. First and foremost, I want to talk to you about sterile gloves. We use sterile gloves for inserting Foley catheters, doing tracheotomy care, and things that require very strict sterile sterilization while we are, as nurses, performing the duties. I also want to talk to you about IVs. So let's kind of gear over to this way. IVs is for intravenous use. We use these solutions to give patients medications or internal feedings. Such as TPN. We use this so that the medication can be administered intravenously straight into the circulatory system so that it can get to the destination in your body faster and a much efficient rate. Okay. We do start IVs here on site as we have IV starter kits. We use variation of different size gauze such as 18 gauge, 22 gauge, and it really just depends on the patient and whom we are working with. We also have IV extension kits. As you guys know, after inserting an IV, the IV's ports can be very short, which means we need an extension so that we can properly take care of the patient and administer all medications appropriately and according to the physician's order. I want to show you what an IV line looks like. The IV line is here. And as you know, once we insert the IV line, we connect the IV extension, right? Then we have the IV line. We connect the IV line to the bag of medication. Regardless of what the medication is, that doesn't matter. It's the fact that we have medication in a bag that we are going to administer to the patient. So once we administer the medication to the patient, this is the line that is going to be used so that the medication can appropriately and effectively get from the bag of medication to the patient. Got it? Cool. Now, let's move along. One thing I love about the Sims Lab is because it gives you the opportunity to practice before you enter the real world. We want safe, efficient nurses. Competent, efficient nurses. So I want to kind of turn our heads to another skill and or some tools, medical tools that we use to form our care. Many of our patients have G-tubes. Many of our patients have trachs. What is a trach, some may ask? A trach is an artificial opening in the trachea that allow our patients to be able to breathe. Many of our patients have COPD or maybe atelectasis of the lungs and they just can't breathe like the normal person. So an artificial opening is inserted into the trachea so that our patients can properly breathe. Yes, properly breathe. So we have a trach. What's important is that our patients don't get atelectasis, which is the inability to breathe, which causes many of our patients to develop pneumonia. So we must suction. This is so important to a tracheotomy patient because, like me and you, we can inhale and exhale. Many of our patients cannot. So it leaves them very vulnerable. This is a suctioning catheter kit. We put this suctioning catheter kit directly into the patient's trachea, and we must suction. What's important about this is that it's sterile. Remember when I told you about those sterile gloves and how important it is to prevent the spread of infection? Let me show you. These are the gloves we use. We don't use Clean Technique. Clean Technique would be your regular gloves. You know, gloves that you may wear at home. No, we don't use that. We use sterile. We are really big on sterility here at ACI. Why? Because as we know that the number one way to prevent infection is by using hand hygiene first and by practicing sterile techniques the proper way. So we must then, we're going to connect the tubing together like this. And this tubing is connected to the wall. Here we have suctioning. Are you able to see that? Now we have the Foley catheter. Do you know what a Foley catheter is? No worries, I'll tell you. A Foley catheter is a system that we use to insert into the patient's bladder so that we can eliminate the urine. Most patients do not have the ability to urinate on their own, which means they need our help. No worries. We use the closed system Foley catheter here, and I will show you some of the things that are in the Foley catheter that we use so that we can promote emptying of the bladder so that we don't cause other complications. As you know, Foley catheter is a sterile technique, so we won't go into details there. However, I will show you some of the things in the package that we use to carry out that procedure. We have sterile gloves. Can you guess what sterile gloves are used for? You got it, for sterile techniques. We have drapes. Drapes is so that we can keep down the waste and keep the area clean. We have iodine solution for cleaning. Iodine solution can be used, but other solutions can be used as well in place of iodine in the event that the patient is allergic to shellfish. We have this syringe that is already pre-filled with normal saline. We use this so that we can blow the bulb up in the Foley catheter so that the Foley catheter will not fall out of the bladder, but yet be anchored in place. We have lubrication so that we can safely insert the Foley catheter into the bladder. And then we have, ta-da, the Foley catheter drainage system itself. This may or may not be familiar to you, but it's very common in the healthcare field, and we use this to promote emptying the bladder itself, okay? I want to thank you for joining us here at ACI in our very own SIM lab. Please come again and we welcome you. Have a great day and enjoy.
Hey, John.
Okay, so I wanted to give everybody a peek into our new space that we're supposed to be moving into at the end of July of this year. This is one of our new classrooms, and you can see they've been completely rebuilt out. We've got a nice window here, and we've got space for about 30 students in this particular classroom. Jamie, we could go into one of the medical labs, which I think are down
This way.
this way.
And this is going to be one of our NA labs. As you can see, the sinks will go over here. It's nice and spacious, room enough for 30 students, and again, set to finish at the end of July. So this is going to be another student area, and that's how we do that.
Oh, okay.
Some of this stuff. This is going to be our computer lab, and you can see it's got a raised floor here, and it's got some nice windows here. And there's also a student break area right outside the computer lab. So this will hold about 50 computers. This will be our new entrance here into our campus. You can see they're going to put a door in there. And then these are the administrative offices down this way here. So we've got offices here and all the way down the hall here. Again, we're excited and we hope to be in here by the 31st of July. And we want y'all to come see us. Thanks again for attending the PAC meeting and watching this tour video.